Q&A. This time we are talking about prostate cancer. September is Prostate Cancer Awareness Month. Joining me today is Dr. Klaassen. He is a urologic surgical oncologist here at the Georgia Cancer Center, and he's joining us to talk a little bit about prostate cancer. Remember, you can submit questions during the Facebook Live Q&A. If we can get to them during it, we will. Otherwise, we'll just get the answers from Dr. Klaassen and pass those along. So first off, thank you for joining us today.
My pleasure, Chris. My pleasure.
So first question we're going to ask, how common is prostate cancer?
Sure. So prostate cancer is actually very common. So 1 in 6 men in America will be diagnosed with prostate cancer at some point in their lifetime. And so it makes it the most common non-skin cancer in males in America.
All right. When should prostate cancer screening occur? I know there are screening opportunities for prostate cancer to catch it early.
Yeah, it's a good question. So there's been a lot of debate of when we should screen men for prostate cancer. So if you're a regular guy with no family history of prostate cancer, generally we'll start having a discussion around 50, and basically our guidelines recommend screening between the ages of 55 and 69. Now, if somebody has a history of prostate cancer in their family, so a first relative like their father, their brother, generally we will talk to them a little earlier about that, and we'll start the screening process usually 10 years before their relative was diagnosed. So if they were diagnosed at 53, we may even start talking to men in their mid-40s. So it kind of depends on how early they were diagnosed.
Okay, all right. Sounds good. How is a prostate cancer screening done? What's the process like?
So it's two things. So one of them is just basically a blood test. So the prostate gland itself makes a protein called PSA, and it's the only organ in the body that makes this protein. So this is very specific to the prostate gland, and so we'll get a blood level, and that'll tell us sort of where you stack in sort of the risk category. So the first one is a blood test. The second one actually is a rectal exam to feel the prostate. Now the reason it's important for that is some men will have a tumor in the prostate gland that maybe doesn't make a lot of PSA, but it feels real firm on the rectal exam. So that's typically the two ways that we screen for prostate cancer.
Okay, all right. How is prostate cancer diagnosed? I know we talked about the screening, so based on those results, how do you diagnose prostate cancer?
Yeah, it's a good question. So just because you have an elevated PSA doesn't necessarily mean that you have prostate cancer. It could be from having inflammation. Some men have a big prostate gland. It's a benign growth of the prostate. But certainly when we get these numbers back and we do the rectal exam, we'll sit down in sort of a shared decision-making process between myself as a clinician and then the patient and their family. So, there's risks and benefits to it. So, depending on the patient's age, depending on how sick they are, if they have other comorbidities such as heart disease or other lung issues, we'll say, if we're going to go down this road, are we embarking on it? We're going to embark on it together. And that process typically then leads to a prostate biopsy. So the screening doesn't necessarily tell us that we have prostate cancer. It says, okay, we should be thinking about doing a prostate biopsy. And that basically entails a clinic procedure where we take 12 cores of prostate tissue with ultrasound guidance through the rectum, and we give you a local anesthesia, so it sounds a lot worse than what it actually is,
okay.
But we need to get tissue from the prostate gland in order to be able to tell if there's prostate cancer. So we get these biopsies done, we send them to our pathologist, and then we meet back in a couple weeks to go over the results.
Okay. All right. If someone is diagnosed with prostate cancer after that biopsy process, what treatment options are available to patients?
So there's really three sort of mainstays. Now one of them is called active surveillance. So if you have low-grade, low-volume prostate cancer, we won't necessarily treat you right away. We're going to watch it. And the reason we watch it we'll come back to it later, is there's side effects to treatment. So we call it active surveillance. We're not ignoring it. We're just watching it. And if you need treatment down the road, we'll go down that road. So the two sort of mainstays of treatment for localized prostate cancer is to remove the prostate or to treat it with radiation. So when we remove the prostate, these are usually generally men that are younger, healthy, able to undergo a surgery to remove it. And we do that minimally invasive with the robotic technology that we have here at the Cancer Center. And so that will take place, usually people stay overnight for one night. They go home, we see them back in a couple of weeks, we go over the report. The whole prostate comes out, so our pathologist will look at the whole prostate gland and sort of tell us what we call the pathological stage, so after the prostate's removed. And then this other way is the radiation treatment. So radiation is typically for gentlemen that are maybe a little bit older, late 60s, early 70s, maybe people that have a lot of medical comorbidities and maybe not able to undergo a big surgery. And so that typically entails a referral to one of our radiation oncology colleagues, and they'll go through a series of treatments, usually over the course of about 6 weeks. about 15 minutes a day where they'll actually get radiation treated directly to the prostate gland. That'll take care of the prostate cancer that way.
Okay. And you said we would touch on it. Talk about side effects of treatment.
Sure. So the two main side effects of treatment are erectile dysfunction, where you have difficulty having intercourse, and the other one is urinary leakage, or urinary incontinence. So with the surgery, there's a very dramatic effect. When the prostate glands are removed, everybody's sexual function goes into basically hibernation for a period of time. And when we take when the recovery starts, there's usually a period of a little bit of urinary leakage. Now the urinary leakage usually improves quicker than the sexual function. And then when you're talking about radiation, there's both of these side effects as well, but it's usually a more of a protracted course. So it'll take longer, but eventually the erections aren't quite as good. The incontinence and the urinary frequency happens over the course of time. Now the good news is that as urologists, we're equipped to treat both of these side effects. And so we've got, usually work with you very closely after the treatment to make sure that we're addressing those.
Okay. All right. What happens when the prostate cancer spreads outside the prostate?
Right, so in those unfortunate situations, then we sort of have to take a different approach. You know, the surgery or the radiation typically doesn't have as much of a role when that happens. We'll stage the patient. What that means is we'll get a CT scan to see if the lymph nodes along the prostate gland and into the legs are enlarged. Prostate cancer commonly spreads to the bone, so we'll typically get a bone scan to see if it has spread to the bone. And if it has, then it's a different sort of treatment algorithm than the surgery or the radiation. Usually there's a hormone shot. Testosterone makes the prostate cancer grow, so we put the brakes on the testosterone with a hormone shot. And then now, over the last 10 years, we've got a lot of different treatment options. So chemotherapy in combination with the hormones is one example of that. So it's more of a systemic treatment rather than a local treatment if it's spread outside the prostate gland.
Okay. Talk about the psychological side effects. We've talked about some of the physical side effects. Talk about some of the psychological side effects associated with a prostate cancer diagnosis and the subsequent side effects of treatment and the impact they can have on someone's mental health.
Yeah, I know you and I have talked about this before. This is one of my real passions clinically as well as in the research side of things as well. So, you know, a cancer diagnosis in general is a very big life event, and that can lead to a lot of anxiety, a lot of depression, in some men in extreme situations, suicidal ideation. So we're really cognizant of the fact that even just hearing the diagnosis and what the treatment planning is going to be can be really disruptive. So I'm a urologist. I'm taught to recognize these symptoms, but we've got a great team here, a psycho-oncologist that we often refer patients to, just to have somebody to sort of work through this, and they'll see them on a daily basis or a weekly basis to sort of get through that. And the same thing with a lot of the patients that have had the treatment. You know, you've been treated for the prostate cancer, but you've got the side effects I already mentioned. And this can lead to quality of life issues as well. So we'll do everything we can from a clinical side of things, but certainly the psychological aspect of that is also huge. So we work very closely with our folks here at the Cancer Center to try to help men not just get through things from a physical side of things, but also from a psychological side of things.
Okay. Well, that's all the questions that we have for you right now. Again, reminder, you can submit questions to us. We will get them answered by Dr. Klaassen and get you those answers as soon as possible. We want to thank you for joining us
My
today.
pleasure.
And thank you for joining us there on Facebook, and y'all have a wonderful day.
Thanks.